Hey everyone, I'm Mariana Parks, physical therapist, and today I interview Dr. Dreisinger, and he is going to talk about how powerful it is to add a strengthening component in the spine rehab for lasting results. Dr. Dreisinger has a Ph.D. in exercise physiology from the University of Missouri. He has 40 years of clinical experience in rehabilitation, orthopedics, and physical medicine, and he has served on national and international boards to include Trustee for the McKenzie Institute International and Chair of the McKenzie International Research Foundation. In our discussion, you will learn the importance of adding a strengthening component to a spinal rehab program, why resistive training is key for sustained physical health, the value of cardio versus flexibility versus balance versus strength and how they relate, about the prevention program he implemented for Fortune 500 companies and how important it is to measure clinical outcomes, and also his relationship with Robbie McKenzie. If you feel that this information is valuable, please consider subscribing to our channel, clicking on the bell so you don't miss anything. Give us a thumbs up and share this with other clinicians that you think may benefit from this information. I hope you enjoy the show. Hi, Dr. Dreisinger. Welcome to PT Pro Talk. How are you today?
Mariana, I am fine and I am delighted to be here with you.
Awesome. I'm excited to have you here and honored to share this time with you. So let's start talking a little bit about your career. I mean, you have pages of a resume. Let's try to summarize for the audience a little bit about everything that you've done through your life.
Well, I think the best thing to say is I was born. I lived a marvelous life with an embarrassment of riches, and now I'm retired, and here I am. But if you want more detail, I have an undergraduate degree from Fairmont State University. I have a master's degree from La Crosse, Wisconsin, in exercise physiology, and a Ph.D. from the University of Missouri in exercise science, and with an emphasis in cardiovascular training. So I did cardiac rehab for the first 15 years of my career. I got into spine by accident. In 1987, I met an orthopedic surgeon who wanted somebody to ghostwrite for him. And I don't know if you know what that means, Mariana, but somebody pays you to write and then they publish in their name. So he paid me to ghostwrite for him. And I wrote a patient a treatment book for him, and then I wrote and edited, and then I wrote speeches for him in the early 90s, and then in spine, which I didn't know anything about, but this man was connected to the spine world in orthopedics all over the world, and so for 4 or 5 years, 6 years, he took me all over the world. We gave talks at scientific meetings. I wrote for him. Then I started speaking in 1993, 92, and got involved with the McKenzie Institute in the early 90s in the American branch. And so in 1996, I started speaking overseas after having done quite a bit here in the U.S. And then from then I had a chance in the McKenzie world to do quite a bit of work, but also separately in the orthopedic world. I did quite a bit of traveling and speaking, so I had a chance to see the world and meet great people and learn things I didn't know anything about, and I still don't know anything about very much. But it's been a great career, and I've had a chance to be in the presence of some of the great minds in orthopedics and mechanical treatment of back pain and in musculoskeletal strengthening. So I've been very fortunate. And here I am.
Yes. Oh, yes,
Now
that's
I teach
awesome.
anatomy, and I'm retired, but I teach anatomy and physiology at a local junior college, and I have pre-nursing students, which is a more difficult course, and then I have entry-level students who just need a science credit, and being in the classroom with young people is very exciting. So that's up to date where I am.
Okay, there's a lot in there to unpack. Um, so let me just ask you a little bit about your role in the MDT world over those years.
Yeah, it's an interesting thing because I'm not a physical therapist. So I didn't come to MDT with any predisposition. I wasn't a believer. I wasn't a true believer. I wasn't a disbeliever. I didn't know anything. I was a quantitatively based exercise science person. Coming out of cardiac rehab, you measure everything. And when I came into spine, I discovered we don't measure anything. Well, we say we measure, but we really don't. And so in the early 90s, I met Ron Donaldson through the orthopedic community, the American Academy of Orthopedic Surgeons, and also North American Spine Society, where I just begun to be involved. He then spoke with the American branch, and Dan Kelly invited me to join the MDT USA branch in the early 90s. At that time, I then was treasurer for a little while of the branch. And then then Stacy Lyon came on board, who is a brilliant businesswoman. She is a brilliant visionary, and she took an institute in the U.S. that was not very strong and turned it into the most robust institute in the world. She is a remarkable human being. I would say a remarkable woman, but I want to say a remarkable human being because I don't want to. Sometimes you categorize people by their gender. She's as good as anybody, male or female, in the work that she does. So she basically built the institute. During that time in the 90s, I chaired the American board. We reduced the size of it, and I chaired it for a few years. And then I was asked to form in I think 2004, 2005, the research committee, the International Research Committee. So I helped with Uffe Lindstrom and Betty Sindelar and Ron Donaldson and some others. We formed the research committee, but then we felt like we needed to be separate from the institute in order to be a legitimate group. So we became in this country, a 501c3, and we became a research foundation. We didn't raise very much money until a MDT physio named Mary Shedd came on board. And she was a money raiser in her practice. And so she raised lots and lots of money, relatively speaking. And so we were able to fund small research projects. Then in the late 90s, I was invited to be on the board of trustees for the International MDT group. So I came on board. And with the most wonderful people, Colin Davies and Helen Clare, and Todd Wetzel was the medical director, an orthopedic surgeon from the Eastern U.S., and Uffe Lindstrom, who was my best friend and is now passed away. So he was my best friend, not just in the institute, but personally. So I had this wonderful run. Lawrence Stott was the CEO at the time, and it was a great experience. So in 2018, I left the institute. I wasn't. I'd done enough. It was time to do something else. And by that time, I was 70, almost 70. So I'm 75 now, and trying to keep out of trouble and off the streets. So that's my experience with the McKenzie Institute. It could not have been a more wonderful experience. There is a family feeling within the institute. I was never really part of the family because I wasn't a physio, but I was a cousin. I was a relative, and accepted by everybody that I knew in the institute, and I was loved by people, and I loved them. So that was, in addition to my orthopedic work with the North American Spine Society and the World Congress on Low Back Pain, the McKenzie Institute was a tremendous, just tremendous for my life.
And I know that we were talking about that before, that you personally met Robin McKenzie and were close to him. So just share with us a little bit about how was that, how that honor of meeting him and spending time with him, how was that?
Well, Mariana, you never do anything by yourself. That's the most important thing. And so Vert Mooney, whose name you may have heard of, he was medical director in the institute for many years. Vert was probably the best known orthopedic surgeon in the world at that time, and he was a friend of mine. And he was a very close, for many years, personal friend of Robin. So my introduction to Robin was really because of Vert. So Robin could trust me because he trusted Vert, and Vert trusted me. You know how that works. So it wasn't that Robin thought I was anything special. It was because he loved Vert, and Vert loved me. And so that was my entryway. Robin was always curious about my military background. We talked a little bit about the war. I was a Canadian with a green card here, but I went to Vietnam as in the American Army. Robin was always curious about that. And so we did a lot of corresponding. We did a fair number of phone calls. And I always felt like his insight was astonishing. I mean, the first time I saw him in a crowd of an audience of maybe 500 people, and he said, "Does anybody have back pain?" And a bunch of people raised their hands. He said, "Well, you come up here." And he treated the person without ever having seen them, not ever having talked to them. And actually, at first, I thought he had somebody in the audience that he had prepared ahead of time. So this was an orthopedic surgeon that he fixed, who'd had chronic back pain for a long time. So I met this guy in the elevator the next day. This was in San Francisco. And I said, "So how much did they pay you to do this?" Because I was a real cynic. He said, "Nothing. I didn't even know this guy other than I came to the conference. He treated me, and my back pain is basically gone." So that was quite an introduction for me, independent introduction. So that was Robin, and so I was honored to have known him in his life, and I was honored to have learned from him. So.
Yeah, I love to hear these stories. Well, let's go to what we came to talk about. So I know that you own a couple of spine clinics and added like a lumbar, a cervical spine strengthening component to these clinics, right? So why do you think it's that a powerful combination for lasting results?
Well, your key phrase is lasting results. And my orientation, Mariana, is objective measurement and testing and prescribing. That's my orientation. So when I came to the world of orthopedics, I discovered that there wasn't any measurement at all. Now, the McKenzie method is the closest thing to measurement probably in manual therapy in orthopedics, maybe in orthopedics, period, because there's a standardized protocol, there's a standardized treatment. And everybody should, if they follow the recipe, everybody should be doing the same assessment, and everybody should be doing the same approach to treatment, and being able to rule out those people who for whom McKenzie doesn't work. And so my work was principally, my orientation was musculoskeletal strengthening. So I use big machines to measure strength of the lumbar spine, range of motion strength, and then I use that information to prescribe exercise. So if you think about a treadmill test in cardiac rehab, so what do? You put somebody on a treadmill, you measure their heart rate, and then you see how much energy they have, and from that information you prescribe an exercise based, on their heart rate. So when I came to spine, I did that with all the strength training equipment that I had access to. But in spine in particular, the measurement device was able to allow me to measure range of motion specifically, measure strength at each point through a 7-step range of motion specifically. So I knew what the strength of the spine was. And when I knew what the strength of somebody's spine was, then I could give them an exercise prescription at a sub-maximal level to begin to bring them to greater strength. I think the McKenzie model is a tremendous model for managing episodes of back pain. But in the long run, if you don't strengthen this thing, then it's all for naught. It doesn't mean nothing, but it isn't as helpful. So you move, you sit up, stand, walk, climb, get in and out of chairs, all of that because of strength. And as you get older, your strength goes away or becomes less and less and less, unless you work to make yourself stronger. And so like in McKenzie, before there was any research at all, people in the clinic saw the results. Research never tells you what to do. It tells you what you've already done. And that's what the McKenzie research has done, is told people what it does. Not ahead of time, but behind. Clinically, everybody knew that it worked. So from a strengthening standpoint, time and gravity just slowly take away, until one day you try to do something and you can't do it because you're not strong enough. And so nursing homes are full of people waiting to die because they can't get out of chairs, they can't walk, they can't move because they haven't strengthened themselves. So to me, musculoskeletal strengthening is extremely important, extremely important. And that's why I think the two together were really good, because I know that once I've strengthened somebody, that carries on for quite some time if I teach them correctly. And I know if they have an episode of back pain, they can do mechanical movements and probably help manage those. But without strengthening, I think that that mechanical management of back pain over time is not as helpful.
Yeah. And now that you're talking about measurements, how do you measure that strength? Do you have like a specific way that you used to do in your clinics, different than like traditional physical therapy or traditional rehab?
Well, the good news for me, again, was I didn't come to this as a physical therapist. Physical therapists that use machines to test, they usually only use them until they've paid for them. And once they've paid for them, they don't use them anymore. Because the truth is, in spine, physical therapists really don't like to measure very much. It's just the truth. They don't. They're pretty good in shoulders and elbows and knees and that sort of thing with dynamometers and that sort of stuff. But it's difficult to measure the spine. And so it takes a certain size of technology to sort of do that. So we had a device where you sat in a chair, and in your mind, think about sitting in concrete up to your hips. So now your hips can't move. And the only thing that can move is your low back. And it turns out that the multifidi, if you pretend that this is my trunk and this is my lumbar spine, the multifidi, which are very small, stabilizing and strengthening muscles in the lumbar spine, are very weak, extremely weak. And so when you isolate the spine so only these muscles work, then you're strengthening the low back. Now, when you stand up, there are 3 groups of muscles that stabilize you: your hamstrings, your gluteals, and your lumbar extensors. The weak link, the lumbar extensors. So in our experience, over time, when we strengthen people and then follow them in not just our work, but other researchers, in 70 or 80 articles, have shown that episodes of back pain are reduced going forward when you strengthen the lumbar spine. So it's very high tech. And the reason that it's difficult to scale this up, like, for example, Mark Miller and Chad Gray with IMC do a great job because you don't have to scale anything up as far as equipment and all that sort of thing. You have a model that just works. And the outcome for business is not your clinical treatment. The outcome for business is how much money do you save? That's the metric for business. And so we did prevention with high-tech equipment, and we had great results over time. but it's a bigger animal to try to manage. So it ended up in the long term not being as reasonable to do as MDT does in the IMC model, for example, which is a fabulous model.
Yeah. I am just here thinking about in the clinic, when you do strengthening for the back, we do like the manual muscle testing, which is very subjective, and it's hard to do on the spine anyways. I was just thinking in practical terms, do you have any suggestion of like how can we adapt to be more efficient
Sure.
in the way that we assess this?
Yeah. So let's go back to this idea that this is my lumbar spine and this is my trunk. And these are my legs. So you have to imagine, because obviously this is not my
Who
trunk.
is listening, just imagine or watch the YouTube.
Yeah. Okay. So on a Roman chair, there's an exercise device called a Roman chair where you take a pad and put your trunk on that. You hang down with your trunk and then you extend this way. And you lift your trunk against resistance of gravity. Now, it's not anywhere near as good as high-tech equipment, but it is very good. And it does, there's literature that demonstrates that it does reduce the long-term effect of incidence of back pain. It's important, though, when you think about this, not to have a device that's horizontal, but a device that's at an angular. So your feet are down here, right? And when you're at an angle like this, you're already under a load. If you're horizontal, there's no resistance when you're hanging down until you begin the movement. Now, gravity begins to load your spine, right? But when you're at an angle like this, 45-degree angle or so, now you're loaded to begin with. And the key is not to use your gluteals. You have to practice that, because it's real easy to use those big muscles to extend. In our experience, when we did Roman chair work with athletes, big football players, that they would take 50-pound plates and do extensions on a Roman chair. And I always enjoyed saying, okay, that's the way you're doing them, but you're lifting them with your gluteals. Now, let's do it with just your low back. And I'll bet you can't do 8 or 10. And so when we would stabilize their low back and they just scooped up and lifted just with their extensors, none of them could do more than 11 when they were doing 30 with 50-pound weights using their gluteals. So there are a lot of mechanical reasons for that, but the Roman chair in the clinic is cheap. It's a good way to strengthen the low back moderately, because it's already pretty weak to start. And we used to send patients home with Roman chairs in my clinic, and they could do it at home. So it's but people don't like to exercise, Mariana. The truth is, people do not like to exercise. So probably the folks that are listening to this podcast are active people. But in the pyramid of life, people that exercise are the top 25%. Everybody else is kind of like, maybe tomorrow or next week. So it takes, if I say entropy, do you know what entropy means? Entropy, you can't create or destroy energy. You just change its form. So if you light a match, it burns hot, and then you can't light it again, because entropy takes high energy to lower energy. So going to school is intellectual anti-entropy. You're fighting against the willingness. You're fighting against wanting to stay home and do nothing. When you strengthen or you do aerobic work or whatever, you're fighting against the tendency for your body to be in musculoskeletal and aerobic entropy. And a lot of people just aren't willing to do that. It's hard work. You got to work at it.
Well, I love that practical tip of the Roman chair. And since you are talking about lower back, do you have any tips for cervical?
Yes.
Cervical rehab?
That's the other thing that, and because I didn't come with a physical therapy mindset, I just thought you should strengthen the neck. Most therapists are really afraid to strengthen the neck because they're afraid they're going to do something to hurt somebody. And in fact, it's almost impossible, if you strengthen appropriately, it's almost impossible to injure yourself. And here's the reason why. You begin recruiting muscle with slow twitch. I'm a little in the weeds a little bit here, I apologize. But every time you start strengthening, whether it's with the neck or any other muscle group, you begin with slow twitch muscle fibers. They're the aerobic fibers. And then you move from the aerobic fibers to the mixed fibers, then to the glycolytic, high energy, fast twitch fibers, if that makes any sense. By the time you get to the fast twitch fibers, if you're strengthening appropriately, you're already pretty fatigued. You can't lift anywhere near the amount of weight when you're at the end of that exercise session, that bout of exercise, that you can when you start the first movement. So there's a lot of data in Scandinavia using TheraBands. We used high-tech neck strengthening machines, and then we used regular strength training machines. And I had lots of patients that in my career, some of whom had multiple. One patient in particular was a physician that had been in 2 motorcycle accidents and had a fused cervical spine, and she was afraid to do anything. So we started her very gently, no resistance movement, and within 2 or 3 months, she was back to swimming. She was fully functional. She wasn't afraid anymore, and that's the key that I learned in cardiac rehab, Mariana. Heart patients are terrified to do anything because they're afraid it's going to hurt their heart. Back patients are afraid to exercise because they think it's going to make them worse. That's just this. So the reason McKenzie is so good is you don't have as much to deal with here of fear as you do if you're strengthening. Strengthening is a whole other thought process. So people that are hurt are afraid to exercise. And people that have been told by their orthopedic surgeon or by some therapist, not McKenzie therapists, that if they move their neck, they could have an injury that could leave them paralyzed. Shame on people for saying that, but people do say that. Healthcare providers do say that. So we've had a lot of experience strengthening the necks, very aggressive strengthening of the necks, with no problem. And this TheraBand stuff that was done in Scandinavia strengthened secretaries that had cervical headaches and cervical pain, trained them for several months, sent them home with TheraBands. 3 years later, they had no pain, they still had no headaches, and they were still using their TheraBand. So strengthening is key, not just because it makes you stronger, but it's because it increases the metabolism in the muscle that you're exercising. You increase mitochondrion, you increase organelles, you increase you adapt morphologically to the load you're putting on. I mean, everything gets better when you strength train. Everything gets better, but again, you have to help people get there, because expectations are a big deal. And maybe I could just say this. This is for men in particular. We go to the gym and we see big, strong guys, and we think I should do that, what they're doing, and we do what they're doing, and we don't get any bigger, so we quit because we don't see that kind of result. In my house, I'm the only Ph.D. Now, I'm saying this for a reason. At the University of Arizona, there are dozens and dozens of Ph.D.s. In my neighborhood, there's one guy that's muscular. At the gym, there are dozens of guys that are muscular. Why? Because muscular guys go to the gym. PhDs go to the university. The number of men and women that can become muscular in the population is very small. So if your expectation when you strength train is that you should get big, that's a mistake, because of your genetics, because of your the mechanics of your muscle insertions and so forth. It's a mistake to think that you'll get big and strong if you strength train, and then you get disappointed if you don't. So that's
And when I think it's hard is because even in the clinics, people don't want to exercise much. They want to just the passive treatment, and then when you go to the exercise part, they're like, you see that they're trying to just skip it or do it really quick. And to have these people to maintain that after they are discharged, I mean, it's very difficult.
You have to be a good teacher, Mariana, and it's how you teach. Because you're right. And particularly chronic back pain patients or even acute back pain patients, they want the pain gone and they want to get on with their lives. They don't understand that it takes work. Nothing happens in life without work. You didn't become a physiotherapist because you thought it was a good idea. You became a physiotherapist because you thought it was a good idea. And you went to school and you worked hard and you prepared. And you're not doing this podcast because you think it's a good idea. You're doing it because it's a good idea and you're working at it day in and day out. That's the only way things happen. Nothing happens by magic. Everything takes hard work. That's why IMC, by the way, is continuing to succeed. Mark and Chad, and now I don't know, they have 175 extended clinics or something like that. It didn't start out that way. They worked hard. They were afraid maybe it wouldn't work. They've never told me that, although I know Mark moderately well. But I know from business myself, being in business, that it never starts out the way you would like it to be. It's just hard work.
And so I wanted to ask you about the cardio and the flexibility and the balance versus strength. What is the value of all of them and how do they relate?
Well, that's a great question. And this may be new to some people, but it may not be new. If you want to train your heart, then aerobic activity is helpful. Cardio is helpful. If you want to increase your flexibility, of course, flexibility exercises are valuable. And if you want to increase your balance, which, by the way, is important for somebody my age. So I'm 75. And when the neuromuscular system begins to move toward homeostasis, and when I say homeostasis, I mean the big homeostasis, like when my systolic and diastolic pressure are equal. That means when I'm dead. But this attempt to get to homeostasis all through life goes on all the time. And so you do balancing exercises. Tai Chi is wonderful for that. Yoga is not as good, but it's pretty good. Strengthening is marvelous, by the way, for balance, lower extremity strengthening. But here's the big but. If you strengthen to full range of motion, I mean, if you're doing a curl, for example, and your arm curl, and if your form is really good, and you go through full range of motion to the end of your myotendinous capability at the joint that you're crossing, your flexibility will increase. If you do intense strengthening, which doesn't need to be long-term strengthening, and I'll make the argument to you that one set to momentary failure of any muscle group is all you need, but we could talk about that if you want to. You increase your cardiac, your VO2 max. So when you strength train, if you strength train appropriately, your VO2 max goes up. And by the way, when you strengthen appropriately, your flexibility increases. The only people that are more flexible than bodybuilders are gymnasts. And bodybuilders don't spend a ton of time stretching. They may do some stretching, but they spend a ton of time doing musculoskeletal strengthening through the full range of motion. And that talks to the small proprioceptors, the Pacinian corpuscles, and other things at the myotendinous junction that try to protect the joint, that allow you to increase your range. And so musculoskeletal strengthening gives you increase in all three, all four: strength, endurance, flexibility, and balance. And so I sometimes say this to older patients who don't like to exercise. If you could only do one exercise for your health, if you do musculoskeletal strengthening correctly, you will get the benefit of the other forms of exercise that are important. So flexibility is, of course, important, but you shouldn't try to become more flexible than your genetics allow you to. You don't want to overstretch your tendons and ligaments, which a lot of people do because they think they should. And from balance standpoint, you want to exercise those proprioceptors that kind of, every organ system that I teach in physiology and anatomy has a section on aging, which I hate because it always talks about how when you get older, things get worse. Your immune system, your strength, your cardiovascular, all that stuff. And so every time I teach it, I'm thinking with my students, man, I'm talking about myself, and it's depressing me because I don't want to be reminded that I'm getting old and not as as excited as I have been when I'm younger.
Okay, many questions. So first, what do you mean by strengthening correctly? Is that full range of motion that you mentioned before?
Yes, full range of motion, Mariana, in good form. Most people cheat, men particularly. Men are so, we grow up as men having to overcome and be winners and show, how we can conquer everything. So if we play sports, we have to conquer our other team, which, by the way, we should look at the other team as our best friends, because what does the other team do? It wants you to play your best to beat them. So thank the other team. But men try to conquer everything. And so we have to show how strong we are, conquer our women, our girlfriends, our jobs, whatever. And that's a mistake. So it's important to do proper form. Guys like to show, well, I'm lifting more weight, but their form may be bad, or they may be jerking the weights or throwing the weights. Slow, deliberate movement to muscle failure. Now, there are some people in the McKenzie Institute that I know because I've communicated with them that don't believe it's necessary to do strengthening to momentary muscular failure. I'm okay with that. I get that. But the preponderance of evidence is that that's the case. There's some small studies that show maybe you don't have to, but the preponderance of evidence is that's the case. That's the first thing. And the second thing is don't care about, whether you're lifting more weights or not. If you lift appropriately, you'll get the benefit. And then the other thing that people forget all the time is rest. If you go to failure, like for me, I still strength train, although I didn't pick my parents very well. So I've still got pretty big legs, but my arms look like sparrows' kneecaps, like little bird arms. But I lift regularly. And it takes me now about 8 days to recover so I can lift again. It used to be I could lift every third day or every fourth day so that the muscles would recover. But if you take a muscle to failure and damage that those myofibrils to redo those, then it takes time for rest. And most people they think, oh, I can't rest, I got to get back in the gym. Well, if you do it right, you need appropriate rest for the muscle. That's just the physiology. That's not a method or an idea. That's just the straight physiology. So injury repair takes time. It doesn't happen in 2 days or 3 days.
Yeah. And when you say resistive training, do you mean weights or band resistance, or just you don't need to have anything? Because there is a lot of exercise now that people are doing, like these HIIT workouts, like all body weight. So like, do you feel like the resistive training should have like a weight or like a band or something to resist?
Yeah. So the key is fatiguing the muscle. So whatever you use to do that is what works. So during the COVID, I've got some barbells here and I do some squats, weighted squats. And now that I'll be getting back in the gym here in about a week, but I've been out of the gym. So I use barbells for overhead presses and chest presses and curls because I have a little set in my house. But if you use TheraBand, that's great. The thing to keep it, well, this is too much in the weeds. I don't need to get into that. As you do a mechanical movement, Mariana, you become less strong. So the only difficulty with a TheraBand is the more you stretch it, the more resistance you have, correct? So when you get to a place of poor mechanical advantage, like say this part of a curl, that's where you've got the greatest resistance. And so it's a little bit more difficult. So you have to get past the sticking point of the joint, and then you should have a way to have a little bit, not increase the resistance, but TheraBand is great. It's wonderful. Body weight, full body weight is good if you do exercises that fatigue the muscles. But doing stuff just, going through a 20 minutes or 30 minute or an hour and a half cardio strengthening program, unless you fatigue the motor units, of the muscle, it won't give you the greatest benefit. But doing something is better than nothing, right?
Yeah. Yeah. I was just surprised when you mentioned the bodybuilders that they don't look flexible,
They're
but
very flexible.
yeah,
They're
interesting.
extremely flexible. You should see them when they're not, when they haven't pumped up for a show. They don't look like that all the time, by the way. And I've got a good friend that from here in the U.S. that works for Daimler Chrysler, and she went to Stuttgart for a year, or 3 years actually, to train as a buyer for the automotive industry. And she did her first non-drug bodybuilding contest. She's like 5'11", and non-steroid, just straight bodybuilding. And her flexibility is astonishing. It's absolutely astonishing. You can't become more flexible than your joints will allow you. That's for sure. But no, bodybuilders are very flexible.
That's interesting. Well, I know that you also had a prevention program that you helped to implement over the years, right? So is that related to the strengthening? How was that structured?
Well, that was a strengthening program. And this, again, is a compliment to Mark Miller and Chad Gray with IMC. Our strengthening, our prevention program required quite a bit of equipment. And so we were in the airlines, in United Airlines and Northwest Airlines. We were also in some grocery companies, and we were in 3M, which is a company that does research and makes different items, consumer items. And our results were wonderful. I mean, we had comparable to what Chad and Mark have seen. We had an 80% reduction in revisits to in back pain. We reduced the cost for back pain in United Airlines and Northwest Airlines by nearly 80%. And one of the things I noticed on the IMC website, which was kind of cool, it's been a while since I've looked at it, but they sort of guarantee a 25% reduction in costs. That's actually a fake number because it's going to be better than that. And they know that. If you're doing good prevention and you tell a potential employer or client that you can save them 25%, they think that's wonderful. But you can do 30 or 40% if you do your model right. And so it's almost, despite all the working parts that go into making a program like that, it's important. So we were in 4 sites in the airlines, and our data were equal across all the employees that we worked with. But it's a big animal. It takes equipment and a buy-in by medical people who, by the way, did not believe that strengthening had any value in spine. United Airline medical director would send all kinds of articles, not articles, but all kinds of reasons why United Airlines shouldn't strengthen low backs. He didn't realize that the guys that were starting the program were all research guys who published and knew the data. And so every time he'd write something to the company president, we would bury him in data. And so that's, we knew the literature, and we had clinical experience. So like the McKenzie model, clinicians are what drove the research because clinicians knew this model works. And so then Ron Donaldson came along, and Audrey Long came along, and Stephen May did lots of writing, and all these different people, Helen Clare, published lots of stuff, but they didn't publish it because they had an idea this might work. They knew it worked. And what they were basically doing was just supporting what they already knew worked.
Yeah. Well, that's awesome. And I was just here thinking a lot when you were talking about it. So you were doing the reduction of costs for companies just with strengthening prevention, like
That's
a strengthening program for their employees. And it's focused like on spine or general.
Back and neck, that's all we did. We had no physiotherapists, we had no trainers. We just strengthened people. But here's the reason this works, and you already know this if I just tell you. Injury repair is about increased blood flow. Period. If you don't increase blood flow, you don't have injury repair. I don't care what you're doing with somebody. So it's important to move a muscle. When you exercise at a weight that's 30% or more of the capacity of a muscle to move, blood flow is occluded. So all the blood flow stops, and now you're doing an anaerobic exercise. As soon as you stop that anaerobic exercise, it's like when you hold your breath. You hold your breath, and then you go, when you're done, you gasp to get the air in, right? You blow out and gasp in. So that your muscles basically do that. The capillary beds vasodilate, the metabolites of the exercise are flushed out, and now you have injury repair with neutrophils and eosinophils and macrophages all go in there and start repairing stuff. And so that's the reason that strengthening is so valuable. You injure the muscle carefully. Injure is the wrong word. You stress the muscle and create an inflammatory process is what you do. And once you create the inflammatory process, then the body's immune system goes in and repairs it. That's what it does. So that's why it's so important in the lumbar spine to strengthen, because if you don't strengthen those muscles, they're the weak link, and you're at greater risk for injury. But mechanical management will manage that. That's great. But what do you want to do? You want to try to keep it from, that's right.
Yeah. And how about the clinical outcomes? So I know you help to implement a lot of them too. And is that related to the prevention program as well?
Not really. Because I came out of cardiac rehab again, we measured everything. We knew ejection fractions of cardiac output, and diastolic volume. We measured all that stuff. And again, in spine, the measurement's terrible. And even if you go into the non-operative spine, Mariana, and look at the results, you think, oh yeah, this is pretty good. But then you read the methodology, and you find out that studies don't use similar methodology. So you're comparing one study that does one thing in their method and another study that does something else in their method. And then you're using something like the Oswestry or some other PRO, patient-reported outcome. So I can't show you the slide I was going to show you this morning, but I'll tell you. So there are 10 scales in the Oswestry, and 8 or 10. It's been a while since I've played in that arena. So you can have the same Oswestry score, overall score, and very different individual functional responses. Getting up, walking, all the other things. And so the Oswestry gives you no information about a patient's functional status unless you're looking at the subscales. And by the way, nobody looks at the subscales. So one of the things we tried to do with the McKenzie Institute. So in my clinics, we did clinical outcomes on everything, and we had wonderful data in Missouri where my clinics were. We were the only physical therapy clinic, and we didn't have any physical therapists actually. But in spine, we had the best outcomes in the entire state of Missouri and in the region because we had data. You got to have. If you don't have data, you don't know anything. You know how tall you are because you measured it. You know what time it is because you looked at your watch. You step on a scale. Maybe you're not happy about what you see, but you know how much you weigh. You know what time it is in Brazil right now, wherever your town was from. I can tell you what time it is in Antwerp, Belgium, because of metrics, because we measure. But in physical therapy, we don't measure anything, at least in spine, hardly anything. Even with MDT, we don't have hard measures. The outcomes for IMC are economic measures, the real ones. That's what the companies care about. But also they have great clinical outcomes. But they're PROs, and patient-reported outcomes. So we tried within the institute just before I left the board to do kind of an international outcomes project. So we did a pilot study, and I think we had 13 countries, maybe 12 countries. I can't remember exactly. And everybody was doing the same, the same protocol, the same McKenzie assessment. That's the beauty of the McKenzie model is the assessment. McKenzie's not a treatment in my mind. McKenzie's an assessment. It tells you what to do next. Nobody else does that in physiotherapy. Nobody does that, except guys like me in musculoskeletal stuff, but we're not really physios, right? So that's the beauty of this model. And so anyway, we collected some early data, and we found the results were pretty consistent across the countries. But toward the end, when we left the board, Ufa and I left the board, and Todd Wetzel left the board, and the Institute sort of, lost a little interest in that because it took a lot of energy and time and effort to do it. But to me, without clinical outcomes broadly based across our population that we see, I say we, the McKenzie community sees, it's a harder sell.
Mm-hmm. And then how was that project that you were helping to implement? So you would give to clinics like how to collect their data, how to measure their outcomes, that type of thing?
Yes, we had a form that everybody filled out, and we did some follow-up, initial and some follow-up. I didn't pull the forms up. I got them somewhere buried in the neurochemistry of my computer. But yeah, because I'd done clinical outcomes across clinics before when I was working in cardiac rehab. Although it wasn't anywhere near as technically available in those days. But among the medics people, the people that did the strengthening like I did, there are a lot of clinics that were doing that. We all shared data, and we were all using the same protocol. And so, for example, if you see a cardiologist in Rio de Janeiro, and then you see a cardiologist in San Diego, and that report is sent from Rio de Janeiro to San Diego, it's got your treadmill time with a standardized Bruce protocol. It's got your ECG standardized. It's got your cardiac output standardized. It's got your ejection fraction standardized. So when that cardiologist sees you as a patient in San Diego, that doctor knows exactly how you were treated and how you're doing clinically. Imagine trying to do that even with MDT. You send a report to a therapist across the country. They get the evaluation. They get the number of repetitions, flexion, extension that are on the form. But how do you give the softness or the more particular clinical information without writing long notes? And so McKenzie does so much better at that than anybody else. But imagine that you're a Carlton-born therapist, for example, Freddie Carlton-born, who's passed away, God bless him, or other Stanley Paris. Imagine those guys. How do they keep consistent data from one clinician to another? Even today, if you go into a clinic, a physiotherapy clinic, I've had this experience, my wife has, you see a physio, not a McKenzie physio, and that physio is going to be away for a day or misses, and so another physio steps in. Oftentimes you get a completely different treatment. So it's without protocol and measurement, without standardization, it's really hard to know. And my orientation is totally standardization and measurement. That's my orientation, my training, my orientation.
And what would you advise PTs that they could implement? There is something like that's easy that they can start doing in their clinics. I know there is a lot of McKenzie clinicians that listen to the podcast, or just general clinicians. What can they do in their day-to-day practice to try to implement those things?
Well, I think most importantly, the truth, Mariana, is that very few physiotherapists, whether they're McKenzie or not McKenzie, don't record much in the way of outcomes. If you ask clinicians, well, what their outcomes are like, they'll say, well, all my patients get better. And you say, well, how do you know that? And they go, well, they tell me. Well, that's not a measurement. So it's hard to answer that question because it requires the kind of mindset, again, that IMC has. It has taken the time through lots and lots of effort to create protocols that work. Most of the writers that write research have not been serious clinicians. Helen Clare is a serious clinician. Audrey Long is a serious clinician. But some of the other writers really have not been real serious clinicians. They've written about it because they know the data and so forth and so on. So I don't know how to organize that. If I were still involved, I'd still be trying to organize it. It's kind of hard to do because People don't want somebody stepping into their house and telling them how to arrange their furniture. And because I'm not a physiotherapist, you can't imagine how much resistance I get from physios when I talk about strengthening. Because who am I to talk about that? I'm not a physio. Who do you think you are? Well, I'm just me. So
you and your data.
and I believe in data. So
that counts for something, data.
Well, one of the things that's also interesting, Mariana, you can talk about every different kinds of approaches to anything, and we're talking about spine, and people will disagree and argue my way is better, and I've got all these tricks and nips and things that I do and so forth and so on. But when you talk physiology, nobody disagrees. And so if you start the conversation with physiology and biomechanics, then you've got a place to talk to people, whether they've got whoever trained them, because you can't argue physiology. You can argue methodology and what you do, and my house is bigger than yours, and my method's better than yours. But except for McKenzie, there really aren't any data that support other approaches to mechanical management of the low back or neck. There just isn't.
Okay, well, I guess it's because we use a lot of just forms and like you said, the Wall Street, how you say it. It's just hard because it's very subjective. We don't have something very concrete and solid that we can just compare. So I think that's hard to do.
Right. So you have to count on your clinical experience. And if you were a chef that was in a restaurant, by the time you were a real chef, you could touch the meat with your finger and you could say, that's medium well done, or that's well done, without even cutting into it to see. It takes time to get experience. And one of the disappointing things for me is the DPT program where physios come out of school with a doctorate, giving the impression that they really have a lot of experience. It's like going to an orthopedic surgeon that just finished their residency. I wouldn't go to one of those guys. I'd wait till he'd been in the business 10 years before I even talked to him about the possibility of surgery. So it gives the impression to the lay community that the healthcare provider has more experience than they actually really have. It takes time. It always takes time. And time and gravity.
Before we transition to our final questions, do you have anything else to add on this topic that we are talking about?
Oh, I don't think so. I mean, I used to, when I first started giving talks in the McKenzie world, therapists would challenge me publicly and when I give a talk, or they would come up to me later and say, I don't believe in that strengthening stuff. But then as the years went by, therapists would quietly come to me and say, well, what can I implement into my clinic? But in the beginning, boy, oh boy, I took a lot of heat because if you're a believer in something that you're doing and somebody says, I'm not sure that that's 100% correct, you take that personally. It's like a religion. If somebody says, if I'm a Roman Catholic or a Presbyterian and somebody says something about Presbyterians, well, I take that personally. Well, why would I do that? That's not me. It's just something I believe. So sometimes we get defensive about something we believe that oftentimes we can't defend. So anyway, no, I think if there was anything to share today, it would be strengthening is critical in life. Slow, deliberate, good form, end range movement to failure or muscular fatigue at 10 to 12 repetitions, and then rest. Rest is the key. We don't want to rest because we got to get on and do the next workout. Sometimes I have to wait 14 days if I've worked really hard before I can go back and lift the same weight again. And if I lift every 8 days or 7 days regularly, sometimes I get weaker because my immune system has not had time to repair the damage. And musculoskeletal strengthening is a function of the damage of the myosin fibers, myofibrils, that are the contractile mechanism of muscle. If you don't damage them, you don't get stronger. You got to wear bigger shoes. You can't wear the same shoes you wore when you were 10.
Yeah. Okay, that's awesome. Let's then transition to the final questions. Resource of information. Anything that you recommend us? Books, papers, anything in particular?
Yeah, I think that I've always been keen on systematic reviews or the Cochrane collaboration, which is usually an accumulation of data. But even in reading systematic reviews in the Cochrane collaboration, you got to be careful because maybe they start off with 1,000 papers that they're sorting for the criterion, and then maybe they end up with 13 papers or 10 papers because the methodology, and that tells you the methodology isn't consistent across papers. So I would say systematic reviews and Cochrane collaboration as with an eye to asking questions when you see the data. That's important. There's a textbook that was written about the effect of musculoskeletal strengthening in rehab medicine that was done by Jay Graves, and I don't know if I can't look at it like right away, I won't show you. I can't seem to look. Yeah, here we go. This is an older book, but just so folks can see this. Resistance training in for health and rehabilitation, which has a chapter on spine as well, but it talks about aging and exercise. It talks about different clinical entities and the importance of strengthening. This is the only text that I know of that's dedicated to strengthening across chronic diseases. And the data there's just marvelous data. It's an older book. It's like 2013 or 2012, something like that.
Okay, great. And then what would be the best advice that you give to clinicians that are starting their careers?
Humility is the first thing. Be humble. And don't try to pretend that you know something that you don't know. So it's always good to say, I don't know. At my age, my students ask me stuff, I'm still saying, I don't know. But now your question is my question, so I'll figure it out. There's a balance there because you don't want to give the impression you don't know anything, because then your patients won't trust you. But I think for clinicians that are starting their career, first of all, I hope the clinicians that are in physiotherapy want to help people. I hope that's their motive. If their motive is to make money, they will never be happy. They'll be unhappy their entire lives. And there are a lot of unhappy therapists, a lot of unhappy lawyers, a lot of unhappy doctors, a lot of unhappy PhDs that I know of in my life personally. So have a passion. Whatever your heart tells you to do, follow that. And it may or may not be in this field. I don't use 3% of my academic training, not 3%. And I spent 14 years going to school. So I use so many more things than I was actually trained to do. So build on what you know, be humble, and be grateful for your teachers. And always thank the people who brought you to where you are. Always thank Vert Mooney, Arthur Jones, Robin McKenzie. They're the people that made it happen. I'm nobody. I'm just a guy that showed up. I got on the bus and there they were. And so for me to pretend that I'm something special is just absolutely wrong. I don't know anything somebody didn't teach me. And so that's the best advice I could give somebody.
Yeah, that's very true. And what personal qualities or abilities that you think are important to become a successful professional?
So I was doing I spoke at the Singapore Orthopedic Society in 2014 or 15, something like that. And then I was on a panel where there were young orthopedic surgeons that had just finished their fellowship. And so now they were going out into practice. And so 3 of them gave talks. And one of them talked about how to manage his time with all the social media and stuff like that. Another one talked about, there's a lot of pressure about taking money from companies that have implants, spine implants. And then there was another one that talked about the importance of trying to become not lose friendship with his son and family and so forth. So then we were supposed to respond to this. And so I'm going to answer your question with the response that an Indian orthopedic surgeon who was on panel with me gave to these 3 doctors. And I'm going to make their names up because I can't remember them. So he said to the guy that was that wanted to manage his social media and all of his practice and stuff, he said, "Mr. Chen, you will never be a good orthopedic surgeon if you're trying to balance your life between your professional work and your social media and everything else. You will never be able to do that. You have to unbalance your life and unbalance your life for 10 years if you want to be any good, or you will never be a good orthopedic surgeon. I don't care how well you're trained." Then to the fellow who talked about being concerned about the ethics of, being offered money for stuff, he said, "Mr. Lee, ethics is pretty simple. When you're at home at dinner, and in Asian families, lots of times families around their parents and stuff, not like this country where we don't respect older people very much." He said, when you're at dinner with your mother and you tell her what you did today, if you can look her in the eye, it was probably ethical. If you tell your mother what you did today and you had to look down at the table, it probably was not ethical. It's that simple. And then for the guy who wanted to have a better relationship with his son, he said, "Mr. Chong, your son doesn't need another friend. He's got a lot of friends. He needs a father. Be his father." So that was probably the most profound single episodic experience in my life to distill what you're asking. So the qualities, your word is the most important thing you have. You own nothing else. I don't care what kind of job you have, where you go, what you do. Your word is everything. And if you don't keep your word, people won't want to be around you. They won't want to have anything to do with you. So keeping your word is the most important thing. The second thing probably is recognize that time is your second most important thing in life. When you're young, you don't think about that. Trust me, I see the runway in my life. And I think I mentioned this Chinese proverb, if you want to know what's up ahead, ask somebody on their way back. Well, I'm on the way back. And so I try to share that with my students, and I'd like to share that with the therapists that are watching this. If you're trying to build a successful career because you think it's important to make you look good and be successful, you will never be successful. If you put your head down and do the work, there's an expression called hiding and honing. Honing means to sharpen. Like, you hone a knife and you sharpen it. So in your profession, hide in your profession. Sharpen your profession. In a decade or so, you will emerge as somebody who really knows something. And by the way, then you'll realize this absolute truth about wisdom. I have lots of things on my wall around me. So the first thing is live. The second thing is make mistakes. The third thing is learn from your mistakes. The fourth thing is repeat steps 1 through 3 until you've got some wisdom. The fifth step is realize the wisdom you acquired in step 4 was really not wisdom at all, but it's a realization that brings new wisdom. Number 6, repeat all 6 steps again. So in life, people that are arrogant, full of themselves, and I've been around some of the most, I would say confident, but I really mean arrogant people, the best in the world. I've been around the best in the world. In my life, Ariana, I said to you, has been an embarrassment of riches. I haven't just been around good people. I've been around the best people in the world, in the field that I've found myself in. And for that, I could never have learned what I've learned without their help, without them shortening my learning curve, without them teaching me things, without me listening to them. And Robin McKenzie's right up there near the top. So I suppose that's what I would want to say, because you, Mariana, are the president and CEO of the Mariana Corporation. You will never work for anybody else. You may have a job and somebody might pay you, but you will always be the president and CEO of the Mariana Corporation. You want that corporation to be seen as the best corporation on the planet. And that's the way people should think about their lives and their professions. They're representing not some company. Mark and Chad don't represent IMC. They represent Mark and Chad. And they are the president and CEO, not of IMC. That's their job. They're the president and CEO of the corporation, which is Mark Miller and Chad Gray. And Stacy Lyon, and all these other people who have contributed the building blocks of my career and other people's careers. So I'm extremely grateful, and I'm grateful for you. So not just because of this podcast, but because you're taking the time and energy in your life to do something that you feel passionate about. It doesn't get better than that. So now I'll get off my soapbox. I'm done.
Well, a lot of words of wisdom. I appreciate you taking the time to share all of this with us. And I feel very grateful to have you here, and honored to have the opportunity to talk to you and ask all these questions, and for you to be willing to share all of that. So I have to thank you.
Well, blessings to you.
And Ted, if anyone wants to reach out to you, or if they have any questions, or they want to learn more about you, is there a way that they can contact you?
Well, Marianne, I'm not selling anything anymore. I'm not promoting anything. I've closed down my consulting business. But yes, I'm very happy to communicate with anybody. I do a little consulting where somebody wants me to help with the clinic, with clinical protocols and that kind of stuff. But I've really basically closed the business and given myself over to my students. But yeah, my email address is TEDDREIS, Ted Dreis, @gmail.com. And I no longer have my Therapy Advisors account. So I'm no longer the president and CEO of Therapy Advisors. I'm the president and CEO of the Ted Dreisinger Company, which I've always been. So anyway, yeah, I'm very happy. Vert Mooney was the most giving man that I ever met. Robin and Arthur Jones taught people many, many things. But what stood out about Vert Mooney was he was an everyman. If you ask him for something, didn't matter whether you were a therapist he'd never heard of, or if you were one of the world leaders, which he spent lots of time with, he would answer you. You sent him an email, he would respond. Vert Mooney taught me that is critically important. So yeah, I'm happy to share with anybody.
Awesome. Well, thank you so much, Ted, and I just appreciate you again.
Well, I appreciate you. Take care.